Okay, sorry to be late. Merci pour vous patienter. Bonjour et merci de vous être rejoint à nous aujourd'hui. Let me just start by reminding Canadians that this week is a truly critical week for our country in the fight against the global pandemic. We must practice physical distancing. We must stay strong and stay at home. So unless you are doing essential work like stocking grocery shelves or working on the front lines of our amazing healthcare system, please stay home. You can go for a walk or a run, but maintain your distance and wash your hands when you get home. I know that this is very hard, but I also know that Canadians are resilient, and I know that we can do this. Il s'agit d'une semaine critique dans notre lutte contre le virus. Les Canadiens et Canadiennes doivent pratiquer la distanciation physique. Restez forts et restez à la maison. À moins que vous fassiez un travail essentiel comme remplir les étagères à l'épicerie ou fournir des soins de santé. Vous pouvez aller prendre une marche ou aller courir, mais restez loin des autres et lavez-vous les mains lorsque vous rentrez chez vous. Je sais que c'est très difficile, mais les Canadiens et Canadiennes sont résilients et je sais que nous pouvons le faire. So today we will hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, the Minister of Public Services and Procurement, Anita Anand, the Minister of Innovation, Science and Innovation, Navdeep Bains, et le Président du Conseil du Trésor et le Vice-Président du Comité du Cabinet sur le COVID-19, Jean-Yves Duclos. Dr. Tam, please.
Bonjour à toutes et à tous. So I'm going to begin by an update on our number of cases, but I'm going to use the number that's published on our website as of 9 a.m. this morning, just because, as you know, this is a dynamic situation as different provinces are announcing different things as we speak. So in Canada, as of 9 a.m. this morning, there were 7,708 cases of COVID-19, including 89 deaths. So in addition, at any point in time, there are many other people under investigation, awaiting lab results, or not yet tested. So even if you're not hearing cases in your community, it doesn't mean that there are no cases and that there are no exposures waiting to happen. So we now have completed tests for over 236,000 people in Canada, with about 3.5% of people confirmed as positive and over 93% confirmed as negative. Pour le moment, la principale préoccupation concerne l'introduction et la propagation de virus dans des milieux fermés où habitent des personnes vulnérables. Il y a actuellement un certain nombre d'éclosions dans les établissements de soins de longue durée, des collectivités de Premières Nations et Inuits et dans un établissement correctionnel. Il s'agit de situations fort préoccupantes parce que ces éclosions accélèrent la propagation du virus, mais surtout en raison des graves conséquences pour ces personnes à risque élevé. De plus, les jeunes ne sont pas à l'abri des complications graves. Les adultes de moins de 40 ans représentent 10% de cas qui ont nécessité une hospitalisation et pas plus tard qu'hier. Le décès d'une personne dans la trentaine des suites de la COVID-19 a été signalé. Our greatest concern at the moment relate to the introduction and spread of the virus in enclosed settings where vulnerable people reside. We currently have a number of ongoing outbreaks in long-term care homes, cases in First Nations and Inuit communities, and a corrections facility. These events are deeply troubling, both because they result in outbreaks that accelerate the spread of the virus, but more so because of the serious consequences for those high-risk individuals. However, the young are not spared from severe outcomes. Adults under 40 account for 10% of hospitalizations, and just yesterday, there was the first report of an individual in their 30s who died of COVID-19. We must prevent introduction into vulnerable population at all costs, as well as prevent new travel-related cases from sparking community spread. As all Canadians continue to strictly adhere to physical distancing to protect themselves and others, we expect all travellers coming into Canada to join these efforts. Moreover, because of an increased risk of COVID-19 outside of Canada, the quarantine order now in place requires these travellers go directly home upon arrival and quarantine themselves for 14 days. So we all need to keep up physical distancing while maintaining social connections. Thank you.
Okay, thank you very much, Dr. Tam. Now we will hear from our Minister of Public Services and Procurement, Anita Anand. Anita, please.
Merci beaucoup, Chrystia, et bonjour tout le monde. Alors que nous continuons à travailler dans cette situation vraiment extraordinaire, je tiens à remercier les travailleurs essentiels du Canada. Votre travail aide à contenir la propagation de la COVID-19 et nous vous en sommes extrêmement reconnaissants. As part of these efforts, Public Services and Procurement Canada is aggressively buying in bulk from all available suppliers and distributors. To date, we have ordered millions of swabs, gloves, masks, and other vital equipment. I'll take a moment now to highlight additional progress that we are making. Nous avons signé un contrat avec Medicom de Pointe-Claire, Québec, pour fournir une importante réserve de masques chirurgicaux. Including this order, we have now managed to secure more than 157 million surgical masks to support the response. To date, we have also ordered more than 60 million N95 masks, a key piece of protection for healthcare workers. Delivery of these will begin this week. Nous travaillons également avec Spartan d'Ottawa, qui fournira des trousses de tests rapides pour la COVID-19. Spartan's Made in Canada kits will enable us to test many more Canadians over and above the millions of tests that we have already ordered. On ventilators, we have a significant order through Thornhill Medical in Toronto, part of the 1,570 ventilators that we have ordered from companies in Canada, Europe, the United States, and overseas. We are working to secure upwards of 4,000 additional ventilators and very possibly more. Canadians have always risen to the occasion in times of challenge, and the companies with whom we are working, from every region in Canada and abroad, are clear examples of this important point. I also want to thank Suncor and Home Depot for stepping up with generous donations of personal protective equipment. Nous savons à quel point ces fournitures sont importantes pour lutter contre la COVID-19. SPAC appuiera l'investissement supplémentaire de 2 milliards de dollars dans l'Agence de la santé publique du Canada pour l'achat d'équipements de protection individuelle, y compris pour les achats en vrac avec les provinces et les territoires. We know how important these supplies are to the fight against COVID-19. PSPC will support the additional $2 billion investment in the Public Health Agency of Canada to purchase personal protective equipment, including for bulk purchases with provinces and territories. These funds will continue to be dedicated to purchasing the equipment necessary for our doctors and nurses, hospitals, and other frontline health workers across this country. Notre objectif est d'être aussi bien préparés que possible et les Canadiens peuvent avoir l'assurance que nous explorons toute option possible. I also want Canadians to know that we are working together in these unprecedented times. I have reached out to my provincial and territorial counterparts to ensure that we have strong and established lines of communication with regard to procurement, in addition to the work that is already being done by ministers of health across this country. J'ai communiqué avec mes homologues provinciaux et territoriaux pour m'assurer que nous avons des voies de communication solides et bien établies en ce qui concerne l'approvisionnement, en plus du travail effectué par les ministres de la Santé. Extraordinary measures are required in these extraordinary times to limit the spread of COVID-19, protect critical infrastructure, and ensure that Canada has the supplies required. Our government is leaving no stone unturned. It is all hands on deck right now. Merci beaucoup. Thank you.
Okay, thank you very much, Anita. And now we'll hear from the Minister of Innovation, Science and Industry, Navdeep Bains. Nav, please.
Thank you very much, Chrystia. A little over a week ago, our government announced Canada's plan to mobilize industry to fight COVID-19. Ce plan a comme but de fournir de l'équipement médical essentiel au personnel de la santé et priorise la santé et la sécurité des Canadiens. Since then, we've achieved considerable progress. And as Minister Anand just announced, we've advanced to the procurement stage with the 3 companies we highlighted last week. On Medicom, I will say that in addition to the immediate mask procurement, we are in the process of finalizing an agreement to support the development of manufacturing capacity in Canada. It's strengthening our domestic supply. That remains a core objective of ours, to make sure we have the ability to build these masks within Canada. Another part of our last announcement included a call to action, asking companies to step up in this fight against COVID-19. Well, as of noon yesterday, we have received over 3,200 emails from companies, and we've directly connected with over 2,900 of them. Whether it's companies with ready-to-go products, with products not yet authorized, or for companies whose products need a little more development or who need help scaling up. If you tell us you want help, we will connect you with the relevant federal support to ensure we increase domestic supply so that we have Canadian solutions ready to protect and support Canadians. We have now signed additional letters of intent with 5 companies who have signaled they can assist in the government's response to COVID-19, supplying testing kits, hand sanitizers, personal protective equipment, and medical apparel. As I said, we're refocusing our industrial policy and are deploying funds on an accelerated basis through shortened applications and faster approvals. We're committed to pursuing this strategy to do all we can to make sure that we help our healthcare workers. C'est encourageant de voir que les entreprises sont prêtes à faire face aux défis. Elles travaillent ensemble pour fournir aux travailleurs de la santé l'équipement et la protection dont ils ont besoin. We're also helping bring together industry partners, from the Cosmetics Alliance Canada to Canadian Consumer Specialty Products Association and Spirits Canada. Together, they're working to facilitate the supply of key ingredients to maximize the domestic production of hand sanitizers and disinfectants. Another important step that we've taken is advancing the Next Generation Manufacturing Supercluster Initiative, which brings together more than 970 members into a Canada-wide manufacturing network. It recently put out a call for proposals to its members, and it's making $50 million available to develop and scale up new health products and equipment that are in short supply. And within 48 hours, of issuing this call, the supercluster reviewed and conditionally approved 3 projects for innovative manufacturers to produce ventilators, testing kits, and face shields. As my colleague mentioned, I also want to take this opportunity to recognize companies like General Motors, Ford, Toyota, Linamar, Magna, Shell, Suncor, Home Depot, and Canada Goose. All of them have contributed to the response by donating personal protective equipment and health supplies to local hospitals and medical facilities. And I encourage other companies to follow their lead in generously donating whatever they can during this challenging time. And let me wrap up by reminding everyone that we're in this together, and I'm proud of how industry has stepped up to fight COVID-19. Nous avons tous un rôle à jouer pour aplatir le couvre et soutenir l'économie du Canada. Merci. Thank you.
Okay, thank you, Nav. Et maintenant, je donne la parole au président du Conseil du Trésor, Jean-Yves Duclos. Jean-Yves.
Merci, Chrystia. Aujourd'hui, nous faisons le point sur la mobilisation de 2 forces importantes du pays et des Canadiens. La première, c'est la capacité considérable d'approvisionnement du gouvernement canadien. Et la deuxième, c'est la puissance industrielle significative du pays. Nous annonçons et nous faisons le point aujourd'hui sur cet investissement de 2 milliards de dollars dans les opérations d'approvisionnement du gouvernement canadien pour l'achat d'équipements de tests et de développement de procédures de dépistage rapide, dans l'achat d'équipements de protection individuelle et de désinfectants, dans l'achat de médicaments et de produits pour traiter les gens qui sont malades et dans la fourniture d'équipements médicaux, dont les respirateurs. Nous faisons aussi le point sur l'importante mobilisation de la capacité productive du gouvernement et des entreprises privées à travers le pays. Des milliers d'entreprises se mobilisent pour appuyer les efforts du gouvernement canadien pour appuyer les opérations de santé publique et de soins de santé. Et le Conseil du Trésor travaille étroitement avec Approvisionnement et Services publics Canada pour faciliter et accélérer le travail de collaboration de ces entreprises avec le gouvernement canadien.
OK. Merci, Jean-Yves. Et maintenant, on est prêt à répondre à vos questions.
Merci. Alors, comme d'habitude, on va commencer par 3 questions au téléphone. 3 questions on the phone, 1 question, 1 follow-up, and then we'll turn to the room. Operator.
Thank you. Merci. If you have a question, please press star 1 on your telephone keypad. Si vous avez une question, faites étoile 1 sur votre téléphone à clavier. We have a question from Mission La Flamme à Radio-Canada. Please go ahead. Votre ligne est ouverte.
Oui, merci. J'aimerais savoir, est-ce que votre objectif, c'est de devenir autosuffisant pour la production d'équipements personnels ou est-ce que ou peut-être de certains équipements qui sont difficiles à obtenir sur le marché international et quel est votre échéancier?
OK, je pense que c'est une question pour Anita et pour Nav. Qui veut commencer?
Merci beaucoup pour la question.
Press your mic, Anita.
Pardon. Merci beaucoup pour la question. Nous travaillons en collaboration avec l'ensemble du gouvernement et en partenariat avec les provinces, les territoires et l'industrie pour nous procurer les biens et les services dont nous avons besoin en cette période extraordinaire. Il y a beaucoup de choses que nous faisons maintenant. Nous travaillons par tous les moyens possibles pour obtenir les fournitures médicales essentielles dans le Canada et dans le monde. Pour soutenir les provinces et les territoires, nos travailleurs de la santé de première ligne et les Canadiens en général. Et donc, peut-être mon collègue peut ajouter quelque chose.
Non, merci beaucoup, Anita. Notre stratégie est claire, elle a raison. Nous allons continuer à travailler avec l'autre juridiction pour obtenir l'équipement essentiel. Et en même temps, nous allons avoir une stratégie pour la fabrication ici au Canada. C'est pourquoi aujourd'hui, nous avons annoncé 3 entreprises qui peuvent fabriquer l'équipement essentiel ici au Canada. So, notre stratégie, debout, ici au Canada, pour les capacités domestiques et en même temps, nous allons continuer à acheter l'équipement essentiel par tout le monde.
Micheline, en suivi.
Merci. Oui, merci. Et en ce qui concerne Medicom, vous indiquez qu'il pourrait y avoir une entente très bientôt pour la construction d'une nouvelle usine. Pouvez-vous nous en dire un peu plus à ce sujet-là?
Oui, nous allons investir beaucoup d'argent. Je ne peux pas confirmer combien d'argent maintenant, mais à bientôt, j'espère. Mais nous allons investir pour une usine qui va fabriquer l'équipement essentiel ici à Montréal, seulement pour les Canadiens pour le moment. Et j'espère d'envoyer pour les autres juridictions. Mais pour le moment, c'est une priorité pour les Canadiens ici. So we are going to invest in Medicom through the Strategic Innovation Fund to produce masks here for Canadians. So we have domestic capacity. And the goal is not only to meet domestic capacity requirements, but ultimately to produce masks for other jurisdictions in the future as well.
Thank you, Minister. Operator, next question, please.
Thank you. The next question is from Briar Stewart, CBC News. Please go ahead. Your line is now open.
Yes, thank you. This question is for Dr. Tam. I'm wondering if there's any national tracking going on regarding the number of healthcare workers that have become infected with COVID-19.
Yeah, that's a very important question, and it is part of the data that we wish to get confirmed by the province and territory, so we're working very hard to do that. But of course, we do know of a number of healthcare workers, and particularly related to the long-term care facility outbreaks that you've heard about. Some of the health workers were the initial cases, followed by the residents. And so those are the kind of settings, actually, where that is going on. So we do have knowledge about those particular outbreaks.
And I'm just wondering, as a follow-up, I mean, we've heard from other countries where, you know, they're further down the road in this, that there are some times when doctors, as many as 1 in 4, are off sick at one time because of COVID-19. I'm wondering what kind of contingency plans are in place in Canada if that were to happen here.
I think protecting the healthcare workers in the first place is very important, and it would go all the way from health workers who had traveled. We need to pay special attention to them, making sure that they're not sick and that they're not spreading, of course, the virus in both their family context or in the hospital context. That's really key. So having processes that screen and stop infection from spreading in those healthcare institutions protects the health workers as well as the patients or the residences. Of course, the personal protective equipment that you've just talked about. But of course, as a health professional, I think we all have to also practice everything that we preach, including social distancing, protecting our patients and our family. But for sure, protecting the health workforce is absolutely critical. Secondly is looking at surge capacity. So with the provinces and territories having already engaged medical colleges, retired healthcare professionals, students who are studying in the medical professional field, and all of those engagements are now taking place with provinces already engaging that kind of surge capacity as they need to do, for example, contact tracing for the public health side, as well as surge for the health care system itself. So that planning is extremely active right now so that we maintain that health workforce.
Thank you, Dr. Operator. Third question on the phone before we go back to the room.
Thank you. The next question is from Manon Cornelier from Le Devoir. Please go ahead. Votre ligne est ouverte.
Oui, bonjour. J'aimerais Monsieur Legault, le premier ministre du Québec hier a dit qu'il allait essayer de regarder ce qu'il pouvait faire pour ces personnes qui travaillent dans les services essentiels. Vous avez mentionné Madame Freeland qui remplissent les tablettes des épiceries pour les compenser financièrement parce que ces gens-là sont souvent payés au salaire minimum, donc moins par semaine que ce que va offrir votre prestation d'urgence. Est-ce que le gouvernement fédéral envisage des correctifs aussi de ce côté-là pour éviter de voir les gens qui offrent des services essentiels mais qui sont sous-payés ne pas être se retrouver dans une situation inéquitable?
Merci pour la question. La priorité pour notre gouvernement au niveau économique était premièrement d'être certain que tous les travailleurs peuvent rester à la maison si c'est nécessaire ou pour isolation de soi-même ou pour aider les gens, les enfants qui ne sont pas à l'école, les membres de famille qui sont malades et aussi pour aider les travailleurs qui ont perdu son emploi à cause des effets économiques de COVID-19. C'était la première chose importante. Deuxièmement, et c'est ce que le Premier ministre a annoncé vendredi, c'était pour aider les employeurs, les travailleurs à rester au travail, aider les entreprises, aider les liens entre les travailleurs et les entreprises. On a fait ça aussi. Nous comprenons qu'il y a des industries, des secteurs, incluant les secteurs essentiels, où il y a premièrement une situation où notre pays a un besoin extrême du travail de ces gens dans les services essentiels, mais aussi où il y a des conséquences économiques à cause de nos politiques nécessaires. Et je peux dire que le fédéral est d'accord avec le Premier ministre Legault qu'on doit penser de ces conséquences et on doit trouver une façon équitable pour tous les travailleurs du Canada, absolument incluant ces gens qui font des travaux essentiels comme le travail aux épiceries.
Est-ce que vous avez un échéancier ou un objectif d'offrir cette solution équitable dans les prochains jours ou les gens doivent se ronger les sangs à ce sujet-là?
Comme on a expliqué, c'est une situation extraordinaire et notre gouvernement a compris que c'est important d'agir très vite. C'est ce que la situation demande. Mais une des conséquences des réactions de la politique plus vite que dans une situation normale est qu'il y a des situations dans lesquelles on annonce une politique, on commence à faire quelque chose, mais on doit, dans les jours après, mettre en place tous les détails. C'est ce qu'on est en train de faire. Je ne peux pas aujourd'hui annoncer les détails concernant la situation duquel vous avez posé une question, mais je peux dire qu'on est d'accord avec le Premier ministre Legault qui fait un très bon travail, que c'est une situation duquel on doit penser et on doit faire quelque chose.
Thank you, Deputy Prime Minister. We'll start with the room. Dylan?
Has decided to send asylum claimants back to the United States on the basis of public health. Given that you can speak independent of the government, I'm wondering if you think this will help public health, if this is putting people at more risk, if we see people sneaking around to come in without reporting, and specifically, what did you advise the government about these crossings?
I think obviously in terms of both protecting whoever's crossing and the rest of the population is extremely important for managing this particular epidemic. So I think from our public health perspective, we're there to make do the screening and making sure that together with CBSA, anyone who is sick is properly managed. Of course, a reduction in the number of travelers from any entry point can potentially reduce the introduction, of course, to Canada. And so it's just different layers of measure, I think. But I think that's partly it. And of course, we need to look after each other on both sides of the border as much as we are working on our side. I think our public health officials on the other side of the border is also managing anyone who is sick as well.
And Minister Freeland, your government has talked about a nation-to-nation relationship with Indigenous people. We're seeing some First Nations ask for military support. I'm wondering if they're under the thumb of the provinces, if there's a disagreement with the province, are you going to work with a First Nation? We're expecting a flood risk in Manitoba this year. I'm just wondering if you would be prioritizing that over a request for a field hospital in a First Nations community.
Thank you very much for the question, and thank you for your real focus on Indigenous issues. We really appreciate it. Mark Miller and I were talking about your work, actually. So look, to the flood point, we are very aware that there are emergency situations in Canada every year, even in the years when we are not facing a global pandemic. And Minister Blair and Minister Miller have been working very hard with their teams, specifically, and I should also say Minister Sajjan, and we have been having discussions to prepare to walk and chew gum at the same time. And it's important for Canadians to appreciate that. Floods happen every year. We have been seeing more extreme weather events. And so we appreciate that we need to be ready to handle those potential extreme weather events, even as we continue to work hard to fight the global pandemic. That is the particular responsibility of the Minister of Public Safety, and he is definitely on it. The Minister of Defense and DND is very, very focused on the military's particular role this season and this year to defend and support Canadians, and that's why we heard from them yesterday. When it comes to Indigenous communities in particular, Minister Miller is very, very focused on the specific needs. We heard from Dr. Tam just now that we really appreciate the specific vulnerabilities of Indigenous and Northern communities, and Minister Miller is working closely with Indigenous and Northern communities to understand specifically what they need and specifically what we will need to do to support them. Nothing is off the table.
Merci, Madame la Vice-Première Ministre. Next question, CTV.
I think this is for Minister Anand and Baines. Just going back to the companies that you're working with to produce medical equipment and from other equipment that we're procuring, say, internationally, when exactly are we going to see these companies produce equipment and get that in the hospital, specifically, like a timeline on that? And are we going to allow these companies to produce equipment that we then sell internationally or donate to other countries around the world?
I'll begin and then I'll hand it over to Nav. Thank you for the question. I want to begin by talking about what we do at Public Services and Procurement every single day, 24/7. We are purchasing a broad range of personal protective equipment. We've received already masks, surgical and N95 gloves, and hand sanitizer, and expecting ventilator swabs, gloves, and additional masks in the future. So we are taking a very aggressive and proactive approach to procurement every day. We are working 24/7, and this country has never seen procurement like it is occurring right now. It is broad-based and it's aggressive. And on that basis, I will say that the timeline is long. We are engaged in procurement immediately as well as in the long term to ensure that Canadians have the equipment that they need to keep frontline healthcare workers and beyond safe. And in terms of the particular companies, we are expecting supplies this week, actually, ventilators in particular. And I will turn it over to Nav, who can continue with the explanation.
No, thank you very much, Anita. Just to build on what Anita has said, we are dealing with global demand. And of course, we recognize that our global supply chains are also, there's enormous amount of pressure and they're unstable as well. That's why we are partnering up with industry to build domestic capacity. The Medicom example that I highlighted with you earlier is an example of how we're using industrial programming like the Strategic Innovation Fund to build up that capacity with the primary objective of providing essential medical equipment for Canadians. So these are Canadian companies that are retooling to provide solutions to Canadians, particularly for frontline healthcare workers and to support our healthcare system. And so that is our number one objective. In the long term, if we're in a position to build up such significant domestic capacity to help out other jurisdictions, I think it's incumbent upon us to consider that because this is a global pandemic. This is not about just protecting Canadian lives, but we have a responsibility to other countries. But right now, our primary objective is to recognize that global demand is going up, global supply chains are unstable. We need to build domestic capacity to protect Canadians, and that's exactly what we're doing.
And so they are mandated then to keep what they're producing here in Canada for Canadians.
So when we are, for example, in an arrangement with them to help them retool or rescale, clearly the objective is to make sure we meet with the demands and the requests made by the provinces and territories. That is the objective, saying we are going to help you scale up or retool so that you can provide those essential medical pieces of equipment, personal protective equipment for Canadian frontline healthcare workers. That is clearly the objective. But as I was saying, in the long term, because as Minister Anand just mentioned, some of this equipment is going to be made available not in months, but in weeks. We want to make sure that we provide that equipment for Canadian healthcare workers. And then down the road, if we're in a fortunate position where we have the ability to help other jurisdictions out, we should also consider that. But the number one priority is helping Canadian healthcare workers.
Okay.
Sorry, that was one question, one follow-up already. That was a follow-up. There's a lot of folks on the line. Julie, CBC.
My second question, though, was about...
It's one question, one follow-up, please. Okay.
Thank you. My second question was about... There have been numerous reports in Europe about masks coming from China being defective. The Chinese embassy here in Ottawa tweeted the Bank of China has donated us some masks. Are we doing any checks to make sure what we're getting from China is effective and functional?
Well, I thank you for the question, and obviously that question pertains to goods across the board, not only from China. That public health has specifications and requirements that need to be met in order for PPE to be distributed and utilized safely by frontline healthcare workers. And so I will say that once the shipment comes in, and I'll ask Dr. Tam if she'd like to add in on this point, there is inspection to make sure that the specifications are met. In addition, we are making sure that in China there is quality control on the ground there. I have been in close touch with Ambassador Dominic Barton actually every single day to make sure that we have people on the ground in China who are assisting us with our procurements there, and they are performing an excellent and very useful service for Canadians on the ground in China, and that makes the procurement process in many, many respects much more smooth. Dr. Tam?
Yes, I can confirm that any kind of donation, we will need to make sure that we meet the standards in Canada. So Health Canada, who's the regulatory authority, has posted those criteria and guidance, but each of those donations will be checked in terms of whether they meet the standards.
Julie, CBC.
Yeah, hi, Julie Van Dusen, CBC. I'm not sure if it's for Ms. Freeland or for Dr. Tam, but we know that about a third of the 65 COVID-positive cases in Windsor, Essex, are Canadian healthcare workers who cross the border, they work in Detroit, they come back with the virus. So the question is it time to stop the back and forth, or is there another way to deal with it?
I'll start that answer because actually last night I had a very good conversation with the mayor of Windsor about precisely this issue. He is very focused on it, as are the local MPs. And he has been in very close touch with he reported to me that he's been in close touch with both the Canadian hospital and the U.S. hospitals. Economies are that there are in Windsor both Canadian healthcare workers who every day cross the border to work in Detroit, and there are also people who cross the border from the United States to work in the Canadian healthcare system. Have been put in place at the hospitals both on the U.S. and Canadian side of the border to very carefully check the health of the healthcare workers to be sure when they go to work and when they leave work that they are healthy and well. And also opportunities have been offered to them if they would prefer not to go home to their families to be able to stay in hotels close to where they are working. So a lot of very hard, very important work is being done on the ground in Windsor. And I really want to say the mayor is completely on it. And I want to thank him for his hard work. It is a situation that we are monitoring closely, and we need to monitor closely, and we are going to continue to do that every single day. And if Dr. Tam wants to add something.
I think just to add that we're also connecting with Ontario and their public health officials in terms of the sort of procedures and guidelines that they're putting in place as well for healthcare workers, but not much more to add. Thank you.
My second question is to either Ms. Freeland or Dr. Tam. And again, it's the fact that for the past few days, everyone's been saying this is a crucial week to see if physical distancing, staying at home, self-isolating is working. I guess the question is, what happens if it's not and infections continue to rise? Is there a plan B?
Look, I'll start. Just to say, we all need to be prepared for the reality, which is the situation is going to get worse before it gets better. That is the unfortunate truth of where we are right now. I'm delighted by the way you framed your question, Julie, because it shows that people are understanding that we can actually make a difference. You know, we mustn't be fatalistic about this. And if we take the right actions, we can have the least bad outcome for Canada. And taking the right actions means, first and foremost, Canadians every day practicing physical distancing. This is a particular kind of crisis where every single person in the country can make a difference. And I know that people are trying really hard, and I can't emphasize too strongly the need to do that. So I think the first answer to the question is, let's do everything we can, and each one of us has real power here to avert the worst case scenario. Having said that, of course, it is incumbent on all of us in government to do everything we can to prepare for a less good outcome. That's why you've heard today from Anita and Nav on the truly extraordinary efforts we're making in procurement internationally and getting Canadian companies who have been terrific, working hard to build what we need at home. I also really want to commend the work of premiers across the country and to give you a sense of how focused the premiers are on being ready for worst case outcomes. I can tell you that just this morning, I was on a conference call with Doug Ford and Francois Legault, which Premier Ford organized himself on his phone to work on procurement. And I had a text from Premier Horgan also with very specific questions. So this is a real Team Canada effort. The premiers are doing extraordinary work. We are getting ready for a less good outcome. But at the same time, even as we say that, let's all of us remember that what we need to do today is do the best we can to avert that. And I think we would all love to hear from Dr. Tam as well about this.
So I think our strategy, I think as I've explained before, twofold. One is everything we can possibly can to flatten and extinguish that initial wave as much as possible. And then the other thing is increasing any healthcare capacity that we can to manage the situation. But everything that we're seeing today in terms of cases would have been people who were infected, retrospectively a couple of weeks ago or more. We also instituted public health action and measures at really ramping up around the sort of March, the sort of 12, 13, 14, and then the week after that. When I spoke to and have these very intense discussions with chief medical officers of health, we stuck to the basic, absolutely trying to double down on the measures that we think works. One is, as we've all said, we need more lab testing. And even though Canada is actually testing quite a lot of people, we want to do more. That is an absolutely critical area, and pulling out all stops to do that. Because identification of cases and then managing the close contact is the key to the public health response. So we've been thinking of how do we make sure that every jurisdiction has the resources they need to do that contact tracing. Contact tracing is quite intensive. If you get a cluster or outbreak, you then have to trace all the people who may have been exposed. Is a really, really important aspect. So doubling down on that. Also, the concept of reducing and extinguishing this first wave is predicated by the fact that we want any infected individual to not pass it on to more than one person, that R0 or R0 concept. If one person that's infected passes it on to two, your epidemic will continue. So that is an ultimate goal. So to do that, this is why essentially social connection, but physical distancing is so important, and for Canadians, because you want to reduce that risk of transmission. And that's why that aspect of the response is so serious. So you've seen across the country, the public health system beginning more and more to restrict those movements in some way. So mass gatherings, when we started, absolutely we shouldn't be going to conferences or these mass gatherings, and then it went down to 250 and then 50, and now pretty much everyone's saying, look, we need to really buckle down and do our maximum sort of physical distancing, making sure vulnerable populations stay home and support them so that they're not at risk of infection potentially in the community or other settings, and all the sort of essential services, having them make sure grocery stores or other places where people do have to visit are also practicing social distancing measures. So that is so important. That's where I think, as we speak, we're still enhancing those measures, and we'll want to see the effect of those, absolutely. And then, of course, at the same time, preparing for the scenarios where you can get increased influx of patients, alternative sites for evaluating patients. How do you house people who are mildly sick but can't be self-isolating at home, having hotels and other things. Homeless shelters cannot manage these outbreaks. So you need alternative sites to manage and isolate people from those vulnerable settings. All of this is happening right now. And so I think that's why I say this week, again, double down and keep going. Is a whole of society response.
Thank you. Operator, sorry. Operator, we'll take 3 more questions on the phone, please.
Thank you. The next question is from Raymond Filion, TVA. Please go ahead. Votre ligne est ouverte.
Oui, bonjour à tous. Des médecins, des infirmières qui sont sur les lignes de front, des hôpitaux aussi au Québec craignent une pénurie de masques. Je vois que présentement, le premier ministre Legault parle de pénurie possible dans 3 à 7 jours. Est-ce que effectivement, il y a danger de pénurie d'équipement à l'heure actuelle?
Merci beaucoup. Oui, c'est très important d'avoir des masques et d'autres équipements pour les médecins et les autres gens qui travaillent sur la première ligne. Et je vous assure que nous avons procuré des masques, des différents types de masques pour les emplois, pour les travailleurs aussi. As I mentioned, we have ordered 60.9 million N95 masks and 157.5 million surgical masks, and some of those are being produced right here in Canada. Donc oui, c'est très important et nous travaillons fort de procurer l'équipement pour les Canadiens et les Canadiennes.
Mais ma question, c'est est-ce qu'il y a un risque, un danger de pénurie? Vous avez répondu qu'il est important d'avoir des masques. Je comprends, tout le monde en convient, mais est-ce qu'il y a danger, un risque de pénurie? Is there a risk of a shortage?
Maintenant, nous travaillons chaque jour et chaque nuit de procurer, d'acheter des masques so that there will not be the risk. And we are working very hard to make sure that we have that equipment to distribute not only to Quebec, but to every single province in this country. And I will add that our efforts are supplementary to the efforts that individual provinces themselves are making. And so, c'est Équipe Canada, as Chrystia said, we are working as a country with the provinces every single day to make sure that we have the equipment that frontline healthcare workers and others require to keep our country safe and to fight against COVID-19.
Si je peux le dire rapidement. Bonjour, M. Filion. Si je peux vous rassurer, ce qu'on vous entendez ce matin, c'est que la capacité d'approvisionnement du gouvernement canadien et la capacité industrielle du Canada sont entièrement mobilisées pour nous surprotéger. On surproduit pour faire en sorte qu'on ait le maximum d'équipements de protection personnelle et d'autres équipements absolument essentiels dont les travailleurs dans les milieux de soins de santé ont absolument besoin. Nous sommes évidemment en appui aux travaux et aux opérations essentielles que font tous les gouvernements des provinces, incluant celui du gouvernement du Québec, parce que nous savons qu'il y a non seulement présentement une disponibilité suffisante, mais il y a aussi évidemment ce souci d'être surprotégé, de surproduire pour que toute la capacité industrielle du pays soit tournée vers la fourniture de quantités suffisantes du matériel de protection.
Merci, Monsieur le ministre. Opératrice, prochaine question, s'il vous plaît.
Thank you. The next question is from Philippe Vincent Foisy, Radio-Canada. Please go ahead. Votre ligne est ouverte.
Oui, Monsieur Duclos, juste vous entendre là-dessus. Je suis pas sûr si j'ai bien compris, mais est-ce qu'aujourd'hui vous êtes capable de dire que dans 2 semaines, si on continue à avoir une hausse de cas comme on connaît actuellement, très, très importante, dans 2 semaines, toutes les infirmières, tous les médecins, tous les patients qui ont besoin d'un respirateur vont avoir le matériel requis. Est-ce que c'est ce que vous nous dites? Dans 2 semaines, dans 3 semaines, tout le monde va avoir du matériel, on ne sera pas obligé de le laver, on ne sera pas obligé de prendre des décisions crève-cœur sur les respirateurs?
Ce qu'on dit aujourd'hui, c'est qu'il faut produire au maximum la capacité industrielle du Canada. Nous faisons face à beaucoup d'incertitudes par rapport à ce qui va se passer dans les prochaines semaines. Un message important, évidemment, c'est que nous avons tous une responsabilité pour faire en sorte que ces scénarios soient les meilleurs possibles dans les prochains jours et les prochaines semaines. Mais le gouvernement canadien a aussi la responsabilité de mobiliser toute la puissance industrielle du pays pour faire en sorte que nous ayons le maximum de ressources disponibles au cours des prochaines semaines et que nous soyons donc prêts au maximum possible à tous les scénarios qui puissent se produire.
Mais est-ce que vous êtes prêts? Est-ce que les gens... Est-ce qu'on peut dire...
S'il te plaît.
J'ai juste posé une question. J'ai juste posé une question. Hey, j'ai juste posé une question.
Pardon, PV, c'est moi qui ai mal compté, vas-y.
Est-ce que on peut dire aux Canadiens, le gouvernement promet qu'il y aura du matériel pour toutes les situations, même la pire qui est prévue?
On vous aime beaucoup, Philippe Vincent, et des fois, il y a des communications un peu brisées, comme vous êtes un peu à distance, là, et c'est correct comme ça dans la situation actuelle. Mais ce qu'on peut dire aux Canadiens et évidemment aux Québécois, c'est que le gouvernement canadien est en mode de mobilisation pratiquement de guerre. Nous mettons toute la puissance industrielle du gouvernement et du Canada au service de la production des équipements dont les provinces et les territoires vont avoir besoin au cours des prochaines semaines. On travaille évidemment très fort avec les provinces et les territoires pour s'assurer que ces équipements soient non seulement disponibles, mais disponibles au bon moment. Nous avons confiance dans cette capacité de collaboration avec les provinces et les territoires. On se prépare pour les pires scénarios, mais on travaille évidemment pour que ces scénarios qui vont effectivement se réaliser soient les meilleurs possibles.
Prochaine question.
Thank you. The next question is from Mélanie Marquis de la Presse. Your line is open. Votre ligne est ouverte.
Merci. Bonjour. Ma première question est pour la ministre Freeland. J'aimerais savoir si vous avez une mise à jour concernant le renvoi de migrants dans leur pays d'origine, donc les États-Unis qui renvoyaient les migrants que le Canada refoulait à la frontière en vertu de la nouvelle entente. Est-ce que vous avez réussi à obtenir quelque chose?
Je peux dire que c'est un enjeu très important pour nous. Le travail continue. J'étais en contact avec le ministre Blair hier soir et ce matin concernant cet enjeu. Il est très engagé. Et aussi notre ambassadeur aux États-Unis, Kirsten Hillman, est actuellement engagé. Et avec nos homologues américains. Et je peux assurer les Canadiens que le Canada prend au sérieux nos obligations internationales concernant les demandeurs d'asile et que le Canada ne fera pas jamais quelque chose qui va contre ses obligations.
Monsieur Duclos, maintenant, sur un plan un petit peu plus économique, on a parlé du rôle des grandes banques dans l'établissement de taux d'intérêt pour ce qui est des cartes de crédit dont elles sont émettrices, des taux qui sont parfois 20 à 30 %. Qu'est-ce que vous aimeriez voir de la part de ces grandes banques-là par rapport à des taux pour éviter que les Canadiens s'endettent encore davantage?
Bien, ce qu'on aimerait voir, c'est deux choses. La première, c'est ce à quoi on s'attend évidemment des grandes banques, c'est qu'elles respectent, et ça inclut le mouvement Desjardins, leur engagement de reporter à la fois les paiements d'intérêt et les paiements de capital pour les hypothèques. Les gens sont souvent pris à la gorge, n'ont pas les moyens de payer ce qu'ils paieraient normalement, leur paiement d'hypothèque. La deuxième chose à laquelle on s'attend des banques et du mouvement Desjardins, c'est qu'elles continuent à non seulement être conscients et conscientes de la précarité de beaucoup de familles au Canada, mais qu'elles continuent à faire en sorte que leur mode de livraison de prêts, et ça inclut les prêts par carte de crédit, soit adapté à la situation actuelle. On sait très bien que les cartes de crédit, ça amène des taux d'intérêt très significatifs. Il y a beaucoup de gens qui, même en temps normal, auraient la difficulté à payer ces intérêts et ce capital. Donc, on s'attend à ce que les banques et le mouvement Desjardins fassent ce qu'elles ont dit au ministre des Finances, c'est-à-dire qu'elles offrent aux particuliers d'autres modalités de payer leurs prêts et de payer des intérêts plus faibles au cours des prochaines semaines et des prochains mois. Donc, on a entendu ce message des banques et du mouvement Desjardins et on a confiance et on croit que ce message va mener à des actions pratiques avec les familles et les particuliers à travers le pays.
Merci, Monsieur le Ministre. One last question on the phone.
Thank you. The next question is from Chrystia Kirkup from the Globe and Mail. Please go ahead. Votre ligne est ouverte.
Hi, good afternoon. Thanks again for doing this. My first question is for Dr. Tam. Right off the top, you mentioned specifically now cases within Inuit and First Nations communities, and I'm just wondering if you could please provide any more specifics on which communities you're talking about with confirmed cases, or what regions of the country, if you're not able to provide that level of detail.
Yeah, there's a number of communities. I mentioned yesterday that Nunavik, which is in the northern aspects of Quebec, had experienced their first case, and some large First Nation community in Ontario, and also I believe in some of the prairie provinces. So even one case in any of these communities is extremely serious, and the leadership in the communities have taken very rapid action in terms of some of those social distancing and restriction of movement measures within the community. And of course, colleagues from Indigenous Services Canada are in close touch to look at what needs there are. But those, and also as we are reporting, not necessarily specifically Indigenous communities, but the north of Canada. So Yukon and Northwest Territories both have cases. And so, and they are introduced into the community from travelers. And all of those, all the Northern Territories are taking very aggressive public health measures to try and prevent introduction, but also adapting what social distancing means in those communities, particularly where they have crowded living conditions, looking for alternative sites, for example, in managing their situation. And also the health system is also revving up to look after different patients, and having very close planning with provinces that are linked to them in terms of medical care and transportation. So all that planning is being done, but any single case in those communities, we have to really take it extremely seriously.
And just as a follow-up, the Indigenous file is a big part of the work that I do, and in speaking just in recent days to some leaders, for example, in Northern Ontario, I've heard that they have 0 test kits in some communities, and I'm just wondering, you know, if we can't figure out who has COVID-19, if there are no test kits available, how can we really get a handle on how widespread this is, and also treatment? I know testing is an issue in a number of different parts of the country, but it seems as though there is serious concern from leadership about their capacity to test at all.
Yeah, and they'll be linked to the bigger system of the provinces and territories as well. But I think there's absolutely a gap that we have to fill, because even the samples have to be flown vast distances to referral laboratories. So one of the priorities that we have right now, and we're evaluating some testing mechanisms where they can do that much closer to the patients. And so the National Microbiology Lab is now actually doing some of those tests on those kind of much more near patient test kits that can be used. And that's actually happening right now, and we'll give you some more information as that progresses. But the goal, of course, is to then equip the territories or the more remote areas with their own capacity, so they don't have to transfer specimens.
Thank you, Dr. Ceci met fin à la conférence de presse pour aujourd'hui. Thank you, everybody.
Je peux ajouter une chose, si je peux, concernant le Québec et la pénurie des masques. Pour pour préciser, parce que c'est vraiment un enjeu que je comprends est urgent pour le Québec. Et je veux seulement souligner que hier, le Premier ministre Trudeau a parlé avec le Premier ministre Legault, que nous, le fédéral, nous comprenons qu'il y a vraiment une situation particulièrement urgente concernant les masques au Québec. La ministre Anand est en train de travailler particulièrement sur cet enjeu et nous comprenons que cette semaine, il y a une situation particulièrement urgente concernant les masques au Québec. Le Québec était très, très clair. Le Québec a une bonne communication avec le fédéral. Je veux remercier le Premier ministre Ford qui a aussi nous aidé en ce travail. Je veux seulement assurer les Québécois et les Québécoises que nous comprenons la situation, remercier le gouvernement du Québec pour la bonne communication et on est en train de la résoudre. Merci.
Thank you. The conference has now ended. Please disconnect your lines at this time, and we thank you for your participation.